Um, our next session is all about medications data in CRISP, and Maia Gottlieb will talk about where to find them in different places and one of the newer tabs in InContext. So I'll turn it over to you, Maya.
Thanks, Kevin. Um, as you said, I will be going over medications and CRISP, the differences between them. Some you probably know about and some you may not. So I will just get going. Next slide. I'm the behavioral health lead, but I also work a lot on medications. And so there are four main types of medications I'm going to discuss today. Just to give you a heads up, we'll go through each one in more detail. We'll start with the PDMP, which hopefully, likely many of you are familiar with, then discuss dispensed medications, reported medications, and medications from claims. And if you have any questions, of course, I'll answer them now or in the future. Next. So something that is interesting and comes up a lot is, why are these medications located in different places? Sometimes it is completely different medications, but other times it is for different reasons. So for example, there are different access permissions. The PDMP requires specific access permissions that are different from regular clinical access. Or they're different sources of data. So we want to be very clear when we present data that these are coming from different sources and may have different reliability or different reporting. And finally, they also come in different formats, which can be very difficult to ensure that we're talking about the same drug if it comes into us from two different places in two different formats. Next. Okay, so starting with the PDMP, which again may be the most familiar to folks, it is the landing page for a lot of folks in Maryland. And the PDMP is the Prescription Drug Monitoring Program. This displays controlled substances or medications with a DEA Schedule 2 through 5. And it is available in the CRISP portal, but access is determined separately from clinical access. So for the PDMP, you have to register specifically for the PDMP, and you have to be a prescriber with a controlled substance license in order to get access, or a delegate of someone with a controlled substance license. So that's different from clinical, which is done through your organization, right? So many folks may have both, PDMP and clinical data. Some folks may only have PDMP, some folks may only have clinical data. A benefit of the PDMP is that because it is mandated by the state to be collected and viewed, certain fields have to be reported. So it's a pretty comprehensive source of data. You'll get a lot of information on the medication and the prescriber and the dispenser. Also, this data comes directly from dispensers. So you have a fair amount of confidence that they are reporting the drug that was actually dispensed. Next slide. So again, this should all be fairly familiar, but this is a sample. This will all be sample data, of course, but this is sample data for the PDMP. You can see there, you'll see the medication, the date it was filled, the date it was written, information about the drug itself, the name of the drug, days supply, quantities, dispensed, refills, etc. I wanted to point out a few specific things that I've highlighted here. So first is just, this will be in the medication management section in InContext. That's that orange circle on the left. As I said, many people will land here first, as it's required to be viewed by many folks, but if not, that's where you can find it. And it is also the first sub-tab up top there in red. I would also like to point out the advisory section up top. So these measurements were determined by the state in an effort to help prescribers notice potential areas of concern, right? So if a patient is receiving opioids with a very high average daily MME, or they're receiving opioids and benzos at the same time above a certain threshold, you'll see that show up in that advisory section. And that may be a flag for folks to talk to their patients. There's also a green circle on the right, and I wanted to point this out because it may get overlooked, but this is how you query for other states. You click that plus button right there, and then if you go to the next slide, you'll see there's a pop-up that comes up, and it'll show the other states. I also wanted to be sure to point out that in order to see data from the Veterans Administration, you have to query the military health system since they have their own PDMP. So that's something that may get overlooked. And that's available here in Query Additional States. That's where you would also query the military health system. In addition, we have agreements with about 33 states. The state of Maryland has agreements with about 33 states, including all the border states. So you can select all those states and that data will then show up in the list of medications. Next page. Okay, so the next kind of type of medication data I wanted to discuss was dispensed medications. So this is the newer one that is now live as of, it was live as of October, end of October, but as of September 1 of last year, dispensers are required to report non-controlled medication data to CRISP. So this is all medication data that is dispensed in Maryland that is not controlled. So it's about, 10 times the amount of data that we get from the PDMP because of just the sheer volume of it. And similar to the PDMP, certain fields are required to be reported. So again, we have fairly comprehensive data available to us in terms of medication information, dispenser information. Unlike the PDMP, though, this is considered clinical data. So if you have clinical access, you'll be able to see this data. It's not PDMP data. It's completely separate in terms of the regulatory requirements. But it has a lot of the same data fields and it's submitted in the same method. The data source, as it says here, is non-controlled drug dispensers. So if you are a dispenser and you're dispensing non-controlled drugs, you have to report to CRISP. Some folks have gotten waivers, but we have a real significant majority of dispensers in the state reporting medication data to us. And I think this is like an incredibly valuable tool for providers. Next slide. So this is just to give you a sense of what it looks like. Again, it's in the medication management subtab, that orange circle on the left, and it's the second subtab up top. Looks a little different from the PDMP in an effort to avoid overwhelming users. If the drug is, given out, you get a drug every week or every month, and it's the exact same dose and everything, it will be grouped together. And you can see in that green arrow, you can expand it to see all of the dispense data. Otherwise, it will all be grouped so that you can see the different drugs and not just be overwhelmed by like a drug that you receive every week. But as you can see here, you also are able to see the medication information, dosage. We also have SIG when it's provided, which can be helpful, quantity dispensed, et cetera, et cetera. And as I noted before, this is not the PDMP. It does not fulfill the PDMP requirement. It's an additional resource for providers. And next slide. Okay, the next form of medications that we have and that we share is reported medications. So the reason this is separated from dispensed medications is because it comes from a completely different source. It comes from all of the organizations that participate with CRISP. So these organizations send a lot of information to CRISP, including often medications. So we're able to parse that data from the messages that they send. And when we're able to parse it and share it, we share what information we've received with users. This is often from hospitals or ambulatory sites, and it includes whatever data is received, right? So we are not validating this data, but we are sharing it because it has come from a participating organization. It also may have some limitations in terms of data. Sites that participate with CRISP just may not have all of the information about a medication and are just providing what they are able to. Next slide. So once again, this is in the medication management section. This is the third subtab there, reported meds. And you can see here, it may be a little bit different. We're only providing, again, what we have available. The fields are a little bit different. And maybe missing some information, but it can be another helpful source if you're working on medication reconciliation or something like that to see what's been reported by other providers. Next slide. Finally, we have medications from claims. And so again, you may kind of understand why this is separated from the other medication sources is because it comes from claims data. So it is included when we receive claims data, which is often later than we receive the other clinical data. So I should have said for dispensed medications, we get those daily. They're required to be reported every single day. Claims data often comes a few months after the medication is prescribed. And we receive Medicaid and case mix data, and that's available. This can be incredibly useful to folks, especially if they want to confirm that the claim was received and processed, or if they're looking for a very long-term history for the patient. This can be very useful. But it is separated out because of that source difference and that timing difference. Next slide. So this is actually not in the medication management section. The orange bubble on the left, you'll see is down a little bit further. That's in the claims data section. It is the first subtab of the claims data section. And you can see here what's available. And it shows you the date, medication information, etc. It also shows you the source of the claim. So is it Medicaid? Is it another payment type? You'll be able to see there. So that is kind of a quick overview of all of the medication data that we have in CRISP right now. There's always potential for more, but you can always contact me or my colleague, Alicia, if you have any questions about medication. I'm not sure if any questions came up during the presentation I wasn't able to answer, but if so, I'm happy to do so.
Thanks, Maya. I think there were questions, just more clarifications of some of the things you said. I think you did answer them though. But if you could just go over them again. So someone's asking a clarification about scheduled drugs. And if you don't have access to PDMP, do they display in the dispense tab?
So no, scheduled drugs only display in the PDMP tab because we're trying to ensure that only the appropriate folks are able to see that per state and federal regulations.
And then someone wants you to go over again the reported medication. So who is part of the reported meds here?
So that is participating organizations with CRISP who are sending us data that we're able to parse. So a lot of organizations, luckily, that work with CRISP send us regular messages about the patients they're seeing. They send us notes and encounters and all that kind of thing that's elsewhere in CRISP. And so part of that, what we receive is often medication as well. And that ends up here. That's where this is viewed. And I see the question, can these sources be combined them? I so appreciate that question. And that's kind of what I wanted to address a little bit, because it is really difficult to combine sources when they come from different places in different formats. And you can't confirm, is this the exact same drug, right? Maybe it was reported to the hospital the day after the dispense. It was dispensed May 12th and the hospital reported us to May 13th. Do we know it's the same drug? We don't with 100% certainty, right? So do we show both? So there are a lot of questions like that that come up. And it's kind of an interesting problem to solve. It's definitely something I think about a lot. And so I definitely welcome any feedback on that.
Right. So lots of questions coming in now. This is great. Someone wants you to go over this out-of-state query again.
So that is just that plus sign button, the green circle on the right. You click it and it'll pop up and show you all the options to query additional states. And then I'm sorry, it's not in this screenshot, but there's just a button that says submit, and you'll submit it. And then the page will reload with those other states' data if there's data available for that patient.
This is maybe a hard one, but I will ask it. Do you have an estimate of the percent of prescriptions that are available within CRISP?
It's really hard to know. That is, I think, a very difficult question. I think with this new dispensed medication tab, which I encourage you all to check out, it really has expanded the scope. Like I said, it's about 10 times the amount of medications period that we had in the PDMP. And I know that the PDMP has a lot of medications. So for instance, all of the major chains are reporting. We're working with a lot of ambulatory sites. We get some hospital data there as well. So it's really hard to say, but we know that there are a lot of folks reporting.
Someone is asking, did you say VA pharmacy information is accessible during the out-of-state query?
Yes, so the military health system is one of the options for out of state that you should definitely check off if you're looking for VA data.
All right. Trying to keep up with all of these questions. These are so good. Um, Someone has a suggestion. It would be cool if there was a marker that said if there was active data out of state. That would be interesting.
That would be cool. It's a little bit tricky because of how we query these states. We only do the query if you say, "Hey, I want to query this other state." So we don't know until we make that query if there's data available. Um,
Someone asked a very specific PDMQ question here. Why is the amount of methadone received dispensed by methadone clinics included in PDMP? Many patients fail to tell us that they're in a methadone program.
I assume that question is why is it not included in the
Oh,
PDMP?
okay.
But I see it, it doesn't say that there, but there are separate laws around how methadone can be sent to the PDMP. And right now it's not a requirement. I know there's a lot of interest in that data, myself included, because I know it could be very helpful for providers. We also want to make sure that we're only sharing it, with the appropriate consents in place.
Someone is asking, basically saying they don't have access to see that other state data. Is there any reason that that might be the case?
I think that's the OFR specific question, and I'm
Yeah.
happy to get back to you specifically. We have specific limitations on the OFR teams based on how it was initially set up, so I can certainly look into that.
There were a couple questions about thinking about redundancy, kind of like the question we got earlier about how we, why it's so difficult for these medications to be compliant. Do you have any suggestions for providers to maybe try to filter some of this out on their own?
That's interesting. I haven't heard that a lot about the PDMP specifically. I think that we rely on the dispensers to report the drug, so sometimes they may report it twice, and that may be an issue. So oftentimes in those cases, we have to work with the dispensers to adjust their reporting workflow.
Awesome. All right. I'm just trying to click through all the ones that we answered. Why isn't the amount of cannabis product obtained by using a medical card listed in PDMP?
So this is an interesting question, and it's certainly come up. I think that it again goes to kind of state law. Another reason that this would be an issue is that much like these other medication sources, cannabis data, when it's collected, has a completely different format and also different permissions. So we really have to think about how to incorporate it and work with the state to make sure that they're able to send us that data and that it's being displayed appropriately.